Dr. Aimee. How are you?
I'm doing great. How are you?
Beyond excited to talk to you. I mean, I geeked out so hard on the last 48 hours on all of your information and so excited to share you and your website and your Instagram and your YouTube with our community. First and foremost, you have a really impressive background. You graduated from UCLA, then you did your residency at Harvard Medical School. You have a master's in public health management and policy from Michigan. I mean, talk about brainy babe. I love it. And I actually found you via Brooke from Everyday Expert, who I am
Wow.
just such a fan of. Like everything she posts, I'm like, I want to do that. I need to do
Yeah.
that. Like her, I might as well just only follow one person at this point. But she had mentioned that her journey um, to motherhood, where her destination being motherhood, involves you. And so
Yeah.
I started following you and just was blown by all the amazing stuff that you're doing and the amazing experts that you have. I definitely spent 30 minutes yesterday watching the live sperm show, which I was like, oh my God, I never knew this. And it's just really incredible what you're doing. And so I thought first we can start with
Yeah.
maybe, I haven't even given you a minute to say hello, but
No,
there you go.
hello. No, I love what you're doing. I've been watching as I've been in and out with patients, and I love all the conversations you've had so far.
Yeah, so maybe you want to start with maybe debunking some fertility myths and
Yeah, I
starting
mean,
there.
there's so many out there. Probably one that we see a lot of is you just need to get pregnant with your first baby, and the next baby will be super easy.
Secondary infertility,
Yeah,
right?
and that's a huge myth, and everyone's eggs will eventually go away. That just happens to all of us.
Yeah.
And so I have these things, I call them the egg whisperer golden rules. And so one of those golden rules is if you're 37 years old, you already have one baby, really think about egg freezing, embryo freezing, or both, right?
Mm.
So when you go to your postpartum visit, the conversation is usually, how are we going to prevent a pregnancy? The conversation isn't, and of course you're tired, you're breastfeeding, and that isn't necessarily something you're thinking of, but I think it's important for someone to just say, hey, this is a fertility myth, because sometimes you hear it from your OB. Because I've had patients tell me my OB said, oh, now that you needed IVF to get pregnant and have a baby, your next one will be easy. And I'm like,
Mm.
I don't know where that's coming from, but that's just not true. And it's really unfair for patients to be told that. Then they wait 2 or 3 years till their next baby. And then they look back and they're like, oh my God, like I could have done something about this. Like I didn't have to just, wait for a year and then get my levels checked. So I think that's a big myth that I deal with every single day, even in 2020, even though I'm doing my YouTube show and I'm trying to share my pearls of wisdom with people, still people, that message isn't out there.
And that's one of those things because on your website you wrote evidence-based science, and
Yeah,
that is one of those things, right? There's just
right.
it's
Things don't get
science,
better as we
right?
get older. I mean,
Right.
I blame Botox for a lot of it because everyone's taking such great care of themselves and they come in here, they're like, oh, I just feel fertile. I'm like, that's amazing. I believe you're fertile. But
Mm.
if you're, let's say, 48 and you look like you're 28, your ovaries don't know that you look 28 on the outside. They're still 48-year-old ovaries.
Amazing, yeah,
Yeah. So
yeah.
let me just think. Another good myth is if you see a fertility doctor, it means you need to do treatment, right?
Mm.
Or you need a referral to go see a fertility doctor. And you don't. I mean, I describe getting pregnant like, I know this sounds kind of uh, what am I trying to say? Dramatic, like jumping out of a plane, right? Like you have no idea. If you've never done it before, you have no idea what to expect, right? And so what do you do when you're going to jump out of a plane? Like they put you through jump school, right? You don't just get on the plane and jump out.
Yeah.
So people need to go to their jump school. They need to go to, and of course I'm plugging myself here, I'm just kidding, of course, but you got to go to your egg whisper school. You got to go to your version of jump school. You got to go to the fertility doctor, go to your OBGYN and say, help me prepare for pregnancy.
And you actually, what I love about your website is you have a lot of not only great resources, great videos, but you've created a program also, TUSHY method, which I
Yes.
just think is so cool,
Yeah.
to help educate. And I think that that's really important. And I was talking to Dr. Shaheen earlier today, and I was
Mm-hmm.
telling him that at 30 years old, And as being as well educated as I am, going to all my sex education courses as a high schooler, and even
Mm-hmm.
in college taking biology, there was so much information about not getting pregnant and getting
Mm-hmm.
pregnant that I didn't even know. I didn't know anything about my cervix. I
Right.
think I knew the location, but like it was basic biology information that I had. And so when I started looking into getting pregnant, I realized that our bodies tell us so much information that is useful. And
Mm-hmm.
I had been put on birth control, I think when I was 15, 16 years old because I wasn't having regular periods.
Mm-hmm.
And so I think a doctor actually told me that I had PCOS because my mom and I both remember somebody
Mm-hmm.
saying that to me. And so it was really challenging when I was thinking about pregnant to think, is this going to be easy? Because I've always been told that my body has X, Y, and Z. It doesn't have a regular period. This is going to happen. That's going to happen. And now I'm dealing with autoimmune, and I'm like, it's our bodies are incredible things. And so, what I think is really important is really getting up to speed, right? Like,
Mm-hmm.
and you do such a great job of educating us. Again, your live sperm show, I had no idea. I think I wrote this down that
Yes.
90% of sperm are abnormal. So
Mm-hmm.
10% being, you know,
Normally shaped. And that's why,
normally.
people always ask, like, why is it so hard to get pregnant? You know, why is it only 15% per try? And that's part of it. It's not every sperm cell is going to have a normal shape. And if you ejaculate, let's say 100 million sperm cell in the vagina, maybe less than 100 will make it to the fallopian tube. And of those, the number that are going to have normal shapes is going to be pretty low.
Incredible.
Yeah.
Okay, so you mentioned on your website that we rely on sources of information that are not rooted, excuse me, in evidence-based science. Are
Hmm.
there other examples of that? Because the one that you gave before was awesome.
Yeah, I mean, I think one example is just what we learn in the media. And
Mm,
so if you look at movie stars and their stories and celebrity stories, they do a lot to confuse and trick women into thinking that IVF doctors have superpowers they really don't. And
mm,
so one of those stories that just was so not, it was great for me in a way because it allowed women who were, let's say, 50 years old and wanted to have a baby to start thinking about that for themselves. And I came up with something called menopausal pregnancy. And if you go to menopausalpregnancy.com, you can learn how you get pregnant if you're in menopause. But the way Janet Jackson's story is who I'm talking about, her pregnancy story was presented in the media was that a woman who is 50 can go do IVF and get pregnant and have a baby. So
mm.
as soon as that story hit, my phone started ringing. Dr. Aimee, you're a great fertility doctor. I bet Janet Jackson had a doctor that's just as good as you. I want you to do for me what Janet Jackson had, and I want a baby now. Not realizing that the conversation is, well, what are you looking for in an egg donor? And there's no shame in needing an egg donor, but people
Mm,
didn't understand that science has not caught up yet with the fact that a woman's eggs completely run out. And for most women, it's by the time they're sometimes even 40. So, 90% of women don't have healthy eggs by the time they're, at 40 if they want a baby. And that's why I'm here to just educate, never to be negative or, I always want to be positive. But when I tell a woman who's 50, that's the age of menopause, I don't want to be the first woman to teach her that. That's not fair. She should know that stuff, just like you talked about
yeah.
when we're younger.
Yeah, I don't know why women don't know more information. I mean, I learned about basal or basil?
Basil.
Basal?
Yes.
Basal temperature in my 30s,
Yeah.
and charting and keeping track of my period and all those things. And I swore that with my daughter, I will teach her as
Yeah.
soon. I don't think my mom, I mean, I'm not even sure if she knows. And so
Yeah.
I would say that that's probably the most important thing, right, is understanding our bodies. I am curious about and I don't know if this is even true, but two questions actually. How does birth control affect a woman's ability to get pregnant? Because and I'm, anybody listening, like I am super into health, but holistic
Mm-hmm.
health. And I stopped taking birth control at 26 because it was
Mm-hmm.
making me crazy. Does it
Yeah.
affect fertility or what's going on?
Yeah. So I think what it does is trick people into thinking they're fertile. That's the
Mm,
biggest harm. And so what happens is, let's say you start at 17, you stop it at 32, your periods never come again. The first thing you're going to do is blame the birth control pill, because
Mm.
you think that somehow the birth control pill made you run out of eggs, but that's really not possible. So that's why one of my egg whisperer golden rules is, if you're going to be on birth control pills, get your levels checked. Get them checked
Mm.
every 1 to 2 years. So you're not one of those people that finds out later that you were running out of eggs the whole time and you thought these regular periods meant that you had fertility, right? Because if you weren't on the pill, you wouldn't be getting your periods, or they would be coming more, they would be more irregular. So you could pick up on that. So there are a lot of non-contraceptive benefits to birth control pills. The non-contraceptive benefits are like preventing ovarian cancer, right? That's one of them. Decreasing anemia. But that is a fertility myth, that it affects your fertility. It doesn't. They don't cause infertility. And in fact, they can prevent the growth of fibroids. They can prevent the progression of endometriosis. So when a woman comes in, she's like, I can't believe I've been on birth control pills this whole time, and this is why I'm here. I need to do a washout. And I'm like, there's no such thing as a birth control pill washout. You have to take them daily, and the next day it's washed out. So it's just important to, get your levels checked. And I actually learned this from Brooke. She taught this to me. I love what she says. She says, test, don't guess. It's as
I love
simple as
that.
that.
I love that.
Yeah.
So when somebody is getting tested, what does that look like? And at what age should people who know that they want to be mothers or parents, when do they start?
Yeah, I mean, I think if you have a family history of infertility, let's say your mom needed fertility treatment to get pregnant with you, or she had endometriosis, I think it's important to get checked even in your early 20s. If you're someone who's, let's say, in your early 20s and you had problems with heavy periods or endometriosis as a teenager, or you had an ovary removed because of an ovarian torsion or a cyst or something like that, again, start in your early 20s. But I think in general, every woman should get their levels checked by the time they're 25.
Mm.
There's nothing magical or awful about 35. People call me all the time, I'm turning 35 in 2 months, or, I'm
Right.
panicking now. And I'm like, no, these things don't happen all of a sudden. It's like, it takes years for our
Right.
eggs to disappear. So there's never an egg emergency. Sperm emergency, that's a whole nother thing. Egg emergency, these things take a long time to happen. So by the
Interesting.
time a woman's 25, she should, understand what's going on with her body. And then certainly there are other tests, like you mentioned, the TUSHY method, getting your tubes checked, especially if you've had chlamydia or something like that, or a ruptured appendix, getting an ultrasound of your uterus to make sure there isn't a fibroid before
Mm.
you get pregnant, checking the sperm, looking at hormones, and then looking at genetics too, like your chromosomes, and looking at whether you and the sperm source carry any shared mutations, like, for example, cystic fibrosis. Those are things that you can do so that your roadmap to pregnancy doesn't have as many potholes.
What I love about that is 25-year-olds are taking control over their body
Hmm.
and their
Oh,
future.
yeah. They're totally fine doing that kind of stuff now.
Yeah.
If you make it easy, accessible, they do it from their phone, they'll get it done.
I don't know how many 25-year-olds are watching, but what would somebody who is 25 who may feel a little bit overreactive, let's say, in being proactive about their fertility, what would they call and say to you or your office assistants?
Yeah, actually, I have a website. It's called eggwhisperer.com, and that's where they go. I have an Egg Whisperer panel, Egg Whisperer consult, and then we get their labs coordinated through Quest Diagnostics or a lab of their choice. And we're looking at hormones like FSH, estradiol, AMH. I usually get results back within 3 to 5 days, and then we set up a call. They fill out a fertility questionnaire, and then I review their goals, when they want to have babies, what's going on in their life, their partner status, sexuality, all that kind of stuff.
Amazing. Um, all right. Oh, so this was a question that somebody asked yesterday. What is one thing a couple can do to increase their chances when trying to conceive?
I mean, the usual stuff, obviously, checking ovulation with an OPK, making sure you're having sex frequently enough and not stressing out too much over it. Meaning, I just joked and said there's no egg emergency. There's also no such thing as a sex emergency. So
I beg to differ. I don't know. There's been
I
sex
know it
emergencies in
feels
my
like it
life.
is, but, I think the one thing probably that a lot of doctors don't talk about is the importance of enjoying sex.
Mm.
And so, I have another method. So I have the Tushy method, and then I also have the balls method. And the S is
Yes.
sex. Like, what is going on in the bedroom? And I think doctors don't talk about that enough. And so I talk about that with my patients. And like, one question, like, this is a silly question, not silly. It's an important one. And I'm glad the husband or, the partner's asking. They say, do I have to help my partner have an orgasm?
Mm.
And I'm like, well, that's really mean. Like,
Yeah.
that's not very considerate and loving. But to be serious about the science of it, when a guy is not enjoying sex, or, if let's say the semen collection for an IUI procedure and IVF, if that semen collection procedure is really, really stressful, the sperm quality is going to be really low.
Yeah.
And so if you take that into the bedroom and you think, well, what can a couple do to maybe increase their chances at home? It's literally find ways to enjoy sex. Find ways to bring pleasure back into the bedroom. I know not every sexual encounter is going to be like a telenovela where you're like tearing each other's clothes off and stuff like that.
But why not?
But why
But why
not?
not?
Right? I mean,
Yeah.
so whatever you can do to see how you guys can enjoy sex again, I think there's no better time than now.
We actually have Mama Gina, who is one of my favorite humans, on May 5th, and she's going to talk about the power of pleasure. And
Uh-huh.
I think it's so important learning pleasure, and specifically having to do with baby making, right? And
Yep.
having that be a really non-stressful, no goal-oriented
Right.
thing is really important. Um, what other things do you think are important for people who are interested in conceiving? Who, I guess, actually, what's one indicator that somebody is going to have that kind of shows that they may have challenges outside of maybe an irregular period?
I mean, age. I mean, if you're over a certain age, you just know that it's really hard. If you're calling me at 44 and you're like, I'm ready to have a baby now, I will tell you that the chances are about 2%.
Mm.
So that's one thing. The other thing is, if, let's say, you were born with a uterus that was not shaped normally, or you're missing a fallopian tube or have a blocked tube, it's just really hard to get pregnant naturally. I know people like are very wishful thinking, and we're all positive. Like, that's what makes us human, is we tend to be very positive, and we like to socially interact, and we like to be hopeful and hope that we're not that person that needs treatment, right? And so, I feel like if you've had a STD or PID or some sort of infection like that, or you've had a ruptured appendix, it's so important to see if your tubes are open or not, because that is potentially an indication that you might need help.
Mm.
And if your tubes are blocked, there's no amount of acupuncture that's going to fix that.
Right.
Those
Right.
are just things that are medical that just need to be treated.
Amazing. And then you're in California, and you're
I
right outside
am.
San
Yep, right
Francisco.
outside
So
San Francisco.
anybody who's interested. And then we had a couple of questions on
Hmm.
here. I'm 25. What can I do to help my body accept it? I don't know if they're talking
Hmm.
about sperm or okay.
Yeah. So, I mean, one of the things I tell women, especially women who are under 30, who are thinking about family and their future fertility, is take CoQ10s or ubiquinol. That's a supplement that can help with egg quality.
Mm.
And starting it at 40 certainly is nice. But if you had started it at 25 when you're ready to have a baby at 40, certainly that might have been more helpful. So to anyone who's 25 out there listening, start it now, and just, you can finish it when you're done having babies or take it even longer, because it's basically an anti-aging supplement. So that's something that a 25-year-old can do. And as far as helping with implantation, I think important stuff is, make sure your body size is healthy. We know women who have a BMI that's over, in the overweight category, their uterine lining is less receptive, compared to women who have a normal, healthy BMI.
Why is that?
I think it has to do with a lot of the hormones that interact with the
Mm.
lining and the receptors that make it so that implantation is less likely. And there are other things that having a higher BMI put you at risk for example, preterm labor, preterm delivery, having a baby with autism, and preeclampsia. So again, that goes back to the jump school and getting your training there. You
Yeah.
know, if someone knew that, then maybe they would say, I'm going to take the next 3 months and get my fertility team assembled, and maybe see a doctor for a medical weight loss program ahead of time.
And you throw these egg what is it called? Egg
Egg
parties?
freezing
Egg
parties. Yes,
freezing
I,
parties.
yep, I
Tell us
started
about
that. I can't
that
believe
because
it. Back in 2014. I can't believe how long it's been.
what is it? What's exciting about it? Tell me about it.
Yeah, I mean, for me, anytime I go out socially, and right now I'm not going out socially, but anytime I go to a party and people are like, "What do you do for work?" I love talking about what I do for work. I say I help people having babies. I help people who need help having babies. And then they start talking to me about fertility, and then I end up like teaching them stuff that they didn't know. And so I was like, "Oh my God, like this is what I love to do. I do it all the time. I might as well just have people join me for a party just so I can talk
Mm,
about fertility and educate them. And I just got so sick of women coming in and saying things like, I wish I had known that. Like, why
mhm.
didn't anyone tell me that? So that's how the parties all started. And that's where the website Egg Whisperer came from, because women would come to the parties and then go to their OBGYN and ask for their levels to be checked. And the OBGYNs back then would say, no, you're too young, you're too pretty, your cycles are too regular. And I'd be
Ugh,
like, that just can't keep happening. So that's where eggwhisperer.com came from, so that I can make getting tested easy and accessible for women anywhere and everywhere. But now the word is out. Everyone knows you can freeze their eggs. And my goal was people should know they can freeze their eggs, just like women can know that they can get their boobs done. I know that sounds silly, but it's like if you have two 30-year-old, they all know that they can get their boobs done. They should know that they can get their fertility checked.
it's
And
kind of
so,
crazy. And I
so
would say that most of my close knit friends who were
mhm.
in our 37 years old, I don't think many of them until they were 35 started getting their eggs embryos removed. And
Yes,
so it's kind of crazy to me that we've waited this long, and we're in a population that knows better.
right,
And so I don't know how you get the word out to 25-year-olds. I'm sure you're already doing it, but
right.
I probably would have rolled my eyes at 25.
Yeah, I mean, I think the Kardashians, I mean, Khloe
Mm.
again is talking about egg freezing. So anytime there's a Kardashian show, I get another flurry of phone calls, because they were talking about egg freezing even, back in 2014. Now they're talking about Khloe freezing her eggs again. So certainly I
Mm.
think that does help. So getting celebrities to talk about getting their levels checked, and the Kardashians have certainly helped a lot.
Yeah. It looks like we have a bunch more questions on here. So, I've had two failed IVFs due to four abnormal embryos after pigs testing.
PGS, yep.
Oh,
I like pigs better
PIGS,
though,
excuse me.
honestly. I like pigs better.
Any suggestions?
Yeah, so for someone who has, so what that is, there's an embryo quality issue. So embryo quality is related to the egg and the sperm. Egg quality is determined by age, genetics, and environment. Sperm quality is that balls method that I talked to you about. So basically, when you have embryos that don't have normal chromosomes, you have to see which side is it. Is it egg, sperm, or both? And see what you can do that's in your control to improve quality. One of the things that I mentioned was taking CoQ10, and certainly there are other egg quality supplements that you can take as well. But talk to your doctor, ask them, what did we learn from this cycle? What can we do differently? Are there different medications, like, for example, HGH? That's something that I give my patients to help with egg and therefore embryo quality, and just keep trying, because there's still hope. If you have embryos that reach that blastocyst stage, and that's the stage that we get to test them and do the PGS on, that means that there's still a chance potentially in a future cycle that you can have a healthy embryo.
Mm, I love that. So right now with everything happening and people being at home, I know you're doing telemedicine.
Yeah,
Even if somebody lives internationally, can they call you or call your
yeah.
center and talk? And how does that work? And what does that look like?
Yeah, so basically I have a contact form on my website. It's draimee.org. And you just fill it out, send it, just hit send, and then I'll reach out to you, and then I'll get something scheduled with you.
Amazing. You're like one of
Yeah.
those people that I like hope to be best friends with, because I am one of those people that like I am obsessed with science. I've always wanted
Yeah.
to be some sort of doctor. Went to college, did my bio 101, was like, this
Right.
is not my strong suit as far
Yeah.
like I had to read my bio books like 10 times to grasp a concept. So you're like my favorite type of person
You're
because you're
very
so
sweet.
based in science and
Yeah.
information, and you are giving all this amazing information for free on your website.
Yes.
um, YouTube, like ladies, go to YouTube and watch it, and it's really amazing that you give this much information for free. And I can tell that you are really dedicated to your audience because the information you give is really valuable and
Thank you.
incredible.
Thank you.
So we have a couple more minutes. Is there anything else
Hmm.
that you think that women or men would benefit from knowing about you and what you do and what you see?
Yeah, I mean, I think just with what's going on right now in our times, is there was a beautiful quote that I saw someone wrote on their Facebook page, and it was that we're all in the storm together, but we all have different size or different types of boats, right? And so I'm really lucky that my boat has what it has in it. You know, I'm very well equipped with the coping skills that I have so that I can get through my day to day. And I know not everyone has that. So I have my little, you know, life vests, and I'm throwing them out to other people's boats right now. And those are people who need help with fertility. But it doesn't matter what's going on. You got to find someone else with a boat that can help you right now. So I don't want anyone drowning. I don't want anyone suffering. You know, as a nation, we have definitely come together. So there's no reason why anyone should feel alone. You know, through, you know, these types of conversations that we're having, people should be having at least 1 or 2 Zoom calls with friends, family every single day so that
Yeah.
they feel well connected. And if you're not doing that, it's super important to do that live with the person so you can connect with another human being. So that's what I want to tell you. Find another boat. If you're having a hard time, if your boat's going down, look for that life vest.
I love that. And you offer such a supportive place even on your Instagram, and you guys are so responsive. I just
Yeah.
love it. So people can reach out to you, I'm assuming via Instagram through your website. Check out all of Dr. Aimee's resources, guides, programs on her website, because again, like even Tushy Method, I spent like 30 minutes just understanding all of it.
Right.
You are, I feel like 360 doesn't work because you get right back to the place that you started, but 180 of, you know,
Right.
just so much information that is really beneficial. Again, all free and incredible, and people can contact you for telemedicine, which is
Yeah.
again another benefit to what's happening. So yeah, we have 3 more minutes. If anybody has any additional questions, I know somebody had a question, and I don't think I can access it because I asked it yesterday about an IUD pregnancy. Does that make
Yeah.
sense?
So I think maybe what they meant is an IUP pregnancy.
Mm,
So an IUP is an intrauterine pregnancy. So that's
got
what
it.
we tell people they have after their transfer is an IUP. So if they
Mm,
did fertility treatment and they did IVF, then that would be an IUP,
got it.
intrauterine pregnancy.
She,
But
it
yeah.
sounded like she had an IUP pregnancy, and then I'm assuming that it did not work, obviously, and then she was
Oh, okay.
asking if she could, when she can conceive again. I do remember that part of the question.
So if it's let's just say if it's an abnormal pregnancy. So every abnormal pregnancy will be different and how you handle it is different. But if let's say a pregnancy miscarried, I typically tell patients with your next period, use that as an opportunity to check in with your doctor and say, why do you think this pregnancy miscarried? Is there anything that you think we should test that could potentially prevent another miscarriage from happening?
Yeah.
Because we do this thing to women, say, oh, honey, it's fine, just try again. And if it happens 2 or 3 more times, then I'm going to start doing some investigations for you. But the last thing that you want to be told when you've had a miscarriage is let's just wait and see. And then the other thing is if you've gone through it several times, you don't want to be told that, oh yeah, there was this test that we could have done, 5 years ago that would have prevented all of this from happening. So I think people should know, unfortunately, we don't know what questions to ask until we have those experiences. So that's why I kind of have my show and do the things that I do so that people can go there. I always have a list of questions. You can print out my blog articles, take them to your doctor, and then just literally just say exactly what I said to your doctor. And then they're going to do that.
I think the biggest thing that's happened in my life in the last 3 years was taking control of my health, right? And
Mm-hmm.
that sounds really basic, but it meant also not necessarily doing everything the doctor suggested, but actually taking that as just one piece of advice, right? And then if it didn't feel right, I would do crazy research or I would get a second opinion.
Mm-hmm.
And I have found that to be the most empowering thing that I've ever learned to do for myself, which was trust my body, know that not everybody knows what's going on, right? Like
Right.
just because there's certain things that they have tested doesn't mean they've tested my thyroid in lots of different tests, right? I learned that there's like
Mm-hmm.
6 different thyroid tests and
Right.
there's probably more. And so if you are a woman and you are looking to get pregnant, like again, there's amazing resources, amazing doctors and experts, and that doesn't necessarily mean that they're right. And there's always more information and there's always other people. I know with fertility, it may take 2 different doctors to get the type of results that you want. And so
Mm-hmm.
finding people like Dr. Aimee, who clearly is incredibly knowledgeable, but also really in tune with what's going on and incredibly well educated to get the information you need to get to the result that you desire. And so don't be shy. If it's not working for you with your current situation, find the next best person who is better suited for your situation. So with that, Dr. Aimee, thank you so much. You are amazing. I hope to have you on again. And again, I am just going to like throw my friendship vibes at you because I want to be best friends and I want to know more information. I may be one of those people that's on your YouTube commenting every single time, like, oh my God, I had no idea. And I think I know so much about fertility and pregnancy, and then I checked out your YouTube videos and I was blown away. So check out the Egg Whisperer on Instagram, check out Aimee's website, and draimee.org, the Tushy method. Just such valuable information. Again, free, which is incredible. Thank you so much for your time, your energy, your love, and for being an advocate for getting people pregnant and doing it in a way that's kind and thoughtful. So thank you.
Thank you. Of course. It was nice.
Bye, Dr.
Take care.
Aimee.
Bye-bye. Have a good one.
Bye.
Bye-bye.